Good morning to everyone present here. Here we are doing a small activity about diseases, how they spread, and how we can prevent ourselves from getting infected by these diseases. So this small activity is to ensure that we are aware about these diseases. First of all, let me introduce myself. I am Janvi, and alongside me I'm Sanskar, and today we are here to discuss about types of virus such as communicable and non-communicable viruses and diseases and numerous type of viruses. Firstly, all of you introduce yourself.
Myself Jaya and I am here to tell you about dengue. Myself Nisha and I am going to tell about malaria. Myself Shani, I am going to tell about pneumonia. Myself Aradhya and I am going to tell about tuberculosis. Myself Srishti, I am going to tell about cholera disease.
Myself Akshat.
Myself Abhinit.
Myself Swanso.
And we're gonna tell you about AIDS.
Now comes to dengue. Jaya, tell me about dengue.
Dengue is a viral and non-communicable disease that can lead to death if not cured properly. So let me define about it. Dengue is a disease caused by female mosquitoes Aedes and the parasite carrying this disease is called Aedes aegypti. It is transmitted from one person to another if a mosquito bites the person infected with dengue and then bites the another person. Some symptoms can be seen like high fever, headache, muscle and joint pain, pain behind the eyes, low level of blood platelets and vomiting. We can take precautions like sleeping under mosquito nets, using nets and repellents and use of coils and vaporizers, wearing full sleeved clothes, etc.
Jaya, would you like to suggest us any vaccination?
Yes, there are two vaccinations available and licensed across the world. They are Dengue and Dengue.
And any history that you know about it?
Dengue first affected the world around 1779 and 1780 when it was spread across the world in Asia, North America and Africa.
Okay, thank you, Jaya, for telling us about dengue. Now coming off to Nisha. Nisha, please explain us about malaria.
Yeah, sure. Malaria is a type of non-communicable disease which is get infected to our blood when the tiny parasite Plasmodium enters to our body when female Anopheles mosquito bites us. It is transmitted from one person to another person. When a mosquito bites a person who is infected with malaria and then bites to another person. Some symptoms can be seen like headache, vomiting, sweatness, fever, etc. And some precautions can be taken is sleep under the mosquito nets, use mosquito repellents and coils, wear full sleeves cloths, and keep surrounding clean and avoid water sanitation. Close doors and windows at night or evening.
Okay, Nisha, can you please tell me about some vaccination and treatment?
There are two vaccinations. First one is R21 and second one is RTSS.
Okay, any history you know?
Malaria is firstly discovered by Ronald Ross in 1897 and it is firstly affected in tropical regions and the ancient civilization areas like Greek and Greek.
Thank you for sharing your knowledge about malaria with us.
Thank you.
Now coming to the next disease, Aradhya, please tell me about tuberculosis.
Tuberculosis is a highly communicable disease which is used to spread by the bacteria known as mycobacterium. It is mainly spread by the active person when the active person is used to speak or sneeze. It is not a permanent disease. The cure rate of the tuberculosis is 90 to 95%. When we cure it by the medication, it takes approximately 2 years, and when we cure it by the treatment, it takes like 6 to 9 months.
What are the vaccinations suggested by the doctor for tuberculosis?
The vaccination which is suggested by the doctor, which that is BCG, the full form of the BCG is Bacilli calmette urine.
Any treatment you know?
Treatment, I don't know.
What are the diagnoses?
Diagnosis of the tuberculosis is X-ray or blood test.
Okay, tell me about some precautions, major precautions.
The major precautions we should take that is we should maintain our strong immune. The second thing we should wear mask, and the third thing we should ensure good ventilation.
Okay, thank you, Aradhya, for telling us about tuberculosis. Now coming up to cholera. Srishti, please tell us about cholera.
Okay. Cholera is a bacterial disease especially caused by Vibrio cholera. It is a waterborne or foodborne disease which affects our small intestine. It is spread through drinking contaminated water, poor sanitation. Some precautions are weakness, muscle cramps, diarrhea, vomiting. There are some precautions, preventions also. That is, drink boiled water, improve sanitations, eat freshly cooked food.
Okay, so Srishti, as you said that diarrhea, cholera, and all you meant symptoms, right?
Yes.
And in how many days do you think the symptoms can be seen?
We see the symptoms in 2 hours to 5 days.
Okay.
Any vaccinations, Srishti?
Yes. Sand coal or ink coal.
Any history that you know?
Yes, first case that is found in Kolkata in 1870.
Srishti, very genuine question. What are the diagnosis methods?
Stool test.
Okay, thank you, Srishti, for telling us about cholera. Now, talking about another disease that is pneumonia. Chandni, please explain us about pneumonia.
Yeah, sure. Pneumonia is a type of communicable disease which affects the alveoli of an individual. It mostly affects the child of age between 5 to 10 years because their immune systems are very weak. As it is a viral disease, so it affects the person who have the weak immune systems.
Chandni, please tell us any symptoms that if I get pneumonia, what are the symptoms that can be seen?
Yeah, there are the various systems that you can see in yourself during the pneumonia, like headache, chest pain, and constant fever, low body temperature, and coughing.
Okay, Chani, tell me about some vaccination or any treatment.
Yeah, there are the various vaccinations which are given to them various ages like PCV 21, PCV 23. The full form of PCV is pneumonia cocaine conjunctive vaccination, which is given to the child of age 21, 15, and infant age.
Okay, Chandni, as you said about symptoms, in how many days will I see these symptoms?
You can see the symptoms within 10 to 5 days.
Okay. And what are the treatments that we go through?
We can go through avoiding that much chill things like cold and avoiding eating citric fruits because it has some amount of acid which can lead us to be cough.
Okay, Chani, tell me about diagnosis process.
It is mostly detected by like pathology like blood test of an individual.
Okay. Last question, Chandni. Would you like to tell us that what are the so Chandni, coming to the very last question, tell us any advices to protect ourselves from this and any advice that you would give to the audience about pneumonia.
As I told, it's a viral flu diseases, so you should must avoid the crowdness. Like you should wear the mask in the crowd areas and avoiding eating cold things excessive.
Okay,
Okay,
Chani.
thank you, Chandni, for your great knowledge about pneumonia.
Thank you.
Okay, now comes to the most incredible disease, AIDS. Anyone define about AIDS?
AIDS is the most incredible disease in the world. It stands for Acquired Immunodeficiency Syndrome. It caused due to HIV virus, human immunodeficiency virus. It kills the immune system of a person and kill a person easily.
What are the symptoms of this disease, AIDS?
High fever, weakness, weight loss are the symptoms of AIDS.
And how many years the symptoms can be detected in a person?
The symptoms can be detected within the 3 to 4 years while doing the regular checkups.
Okay. Okay, then tell me about some precautions.
There are many precautions of AIDS. Some of them are practice safe sex, always use condoms and avoid multiple sexual partners, use sterile needles or new needles, check the blood before transfusion for HIV, care during pregnancy, awareness and education.
So, as you told about the precautions, shall we know about the spreadness? How does this spread?
It is spread through sexual contact
And blood.
or blood transfusion.
Sexual contact. You mean that normal people having sex can have HIV?
No,
Then,
with infected people,
With,
If a person is doing the sexual contact with the infected person, then there is
it
a
is also
chance to
get
get
affected
also
by.
affected by
Okay, did you mean that it is a type of communicable disease?
No, it is not communicable disease.
Okay, then how it spread from one people to another?
we said that by sexual contact with infected people.
And blood transmission.
yes, I get you.
Transfusion.
So, now coming to our next question. What is the lifespan of a person who is not getting treated properly?
if the person is not get treated properly, then on an average he or she will alive from 8 to 10 years. And if the person is taking treatment properly, then he or she will be alive from 20 to 25 years.
Could you tell us about the treatments?
Yeah, there are some treatments such as ART.
Antiretroviral therapy.
It helps to multiply the immune system, that is called CD4 type cells, and it also stops to producing the HIV virus in our immune system.
Okay. At last, any messages that you want to give any messages to the youngster you would like to give?
Our message to the youngster that we should have to follow the precaution carefully and do the regular checkups and stop doing sex practice
And follow the precautions.
and follow.
Be cautious.
Be careful.
Thank you.
At last, we are about to say that precautions are better than
Cure.
Thank you.
thank you.